Have you tried these exercises to relieve your lower back pain without help? Well, there's a good reason why more flexion and forward bending is not going to help, and why it's probably the worst thing that you can do if you've got a disc bulge or herniation in your lower back. If you're new here, welcome. I'm Michael Fatika, the lead osteopath and spine specialist here at Back in Shape. We help people around the UK and all over the world fix their back pain and get back in shape for the long term. And in today's podcast, we're going to help you understand exactly why you need to eliminate knee hugs and child's pose type exercises if you've got lower back pain, because your back health depends on it. It's important to bear in mind that over the years, more or less all of the thousands of patients in clinic and members to the program have joined having been doing these sorts of exercises. And it is understandable because it feels nice in the moment. It relieves some of the pain that you might be experiencing in that moment. And there's two reasons why this actually happens. Reason number one is it's very common when we have a lower back injury for us to get a degree of tension and dysfunction in the muscles around the lower back, and those muscles feel tight. So when we stretch those muscles, it actually feels like a pleasant experience, even if it's causing untold problems deeper down at the cause of that muscle spasm. The second reason is a bit more detailed, and I'll show you on the spine, and that is that for the majority of people, after that initial injury, there's a lot of inflammation that builds up in the lower back. And we've all seen, we've sprained an ankle, or we know someone that has, how much that minor strain to the ligaments can actually result in quite a lot of inflammation. But when it comes to the lower back, when we've strained some of the segments down the bottom here, the discs on the front, we have a very small space on the back of the spine where the nerve comes out. And imagine how much swelling there is in your ankle when it flares up. Well, that happens in this confined space, but we don't have stretchy tissue, stretchy skin to accommodate that extra fluid. We have bony holes. And one of the ways in which we can make these holes larger is going to be by forward bending, flexing forwards to increase the space so that we immediately relieve some of the pain. This is why these are prescribed, that forward bending opening out and immediately creating more space and therefore decreasing the relative pressure in and around that area next to the injury. Those are the two main reasons that it feels nice. But the big problem with this is that just because it feels nice in the short term doesn't mean it's helping you. And for the majority of people with lower back injuries, it tends to affect these segments down here at L4-5 and L5-S1. And it is a constant forward bending that's taken place over the years, sitting, average adult, 9.5 hours a day, flattening out that lordosis, compressing through the front portion of the disc, stretching all of these structures on the back, weakening them to a position where they can bear load, making them more vulnerable. And just think about it for yourself. What was the mode of injury? What was the last time you flared it up? Was it bending down to put your socks on? That's not a strenuous activity unless these structures are very, very weak. Was it something silly that keeps on flaring it up when you're going forwards? It's very unlikely, although it can happen, that you were painting the ceiling in an actually arched position. Most people, when they injure their back, is a load bearing and a bit of forward bending. And therefore, doing that even more so, this being the back part of your spine, this being the front, rounding over more and more and more, is just pulling the poor tissues that are trying to knit back up and tighten back up again apart further, undermining that healing process, creating or allowing the creation of more and more instability at this site that's injured, and really interrupting the process of recovery that's trying to take place. If you're someone that has been struggling with back pain for a longer period of time, we're talking months to maybe even years, then there's a very good chance that the repetitive actions that you've been doing every day, aside from those extra forward bending exercises like the knee hug and child's pose, have actually been reinforcing this elimination of the natural curve. Now, your lower back should have a smooth, natural backward bending curve. This is called a lordosis. It should be around about 40 degrees, give or take a little bit, but it's got a nice rate of curve, a more backward bending curve at the bottom and less at the top as it transitions into the kyphosis of the middle back. And so we spend so much of our time sitting down, like I mentioned earlier, every day, slouching in the car on the way to the office, sitting down enjoying a movie in the evening, all the while eliminating this lordosis. And in our experience, a lot of those patients, but the overwhelming majority, had accompanying x-rays when they'd come in and see us. And we started to see over the thousands of people that it's very common that those with a long-standing lumbar spine issue tend to have, even if they've been diagnosed with something called anterior pelvic tilt, and we've got a video up on there, a link in the description perhaps, but even if they've been diagnosed with anterior pelvic tilt, when you look at them standing up on x-ray, they actually have a loss of the normal lordosis, meaning you are already, when you're standing upright, you are already forward bent through the spine, even in the upright position, and you're not aware of this. And before you say it, yes, sometimes you will have been told that your spine is straightened, maybe because of an MRI or imaging or examination, because you've got muscle spasm. This is preposterous. These muscles on the back here extend the spine. They are extensors. They are the erector spines. They hold you upright. They do not forward bend the spine. So when people tell you the back muscles are tight and it's keeping your spine flat, that is wrong. It's incorrect. And it just shows a real lack of understanding of what this area of the body actually does. It is the ligament balance. You don't see it on the spine model here, but there's a mesh of ligaments that run in between all of these bones and blend with the disc on the back part of the spine and then onto the front. And there's a nice ligament running along the front here as well. And there's a nice balance that should be there between the ligaments on the back part and the ligaments on the front. And you'll notice if you have a look on Google, for example, you'll see all of the ligaments that are on the back part of the spine and this tremendous musculature. And on the front, we've got the anterior longitudinal ligament running down here. But there's a lot that are designed to maintain this natural curve. And our daily life just eliminates that to the point where we're stuck with something that's maybe a little bit more reduced. And I'm not talking about a few degrees here, a little bit of variation. Sometimes we can overblow the actual variation, but in some cases, there are actually significant losses of curve when the person to the point where when the person is standing upright, their spine is maybe 50% lost in terms of the curve that should be going through here. And even when we've done flexion extension x-rays or patients have had those independently, where they actually try and bend backwards, they even can't get, when they try and actually bend backwards, they can't even get back to neutral, let alone actually extended. So they are permanently stuck in this flexion position. And do you think that more knee hugs and child's pose are really going to help deal with this issue? Probably not. It's important to bear in mind, in a normal healthy spine, you will eliminate your lordosis, that backward bending curve, when you say tie your shoelaces up or move. And people conflate the fact that a normal healthy spine should move in all these different directions with an injured lumbar spine. And when you have an injury, you're dealing with different things compared to the normal. And the problem is when the repetitive nature of daily life causes changes in that spine, especially when that spine is injured, it can really be a disadvantage. And if we're given exercises that further replicate the very activities forward bending that we've already been doing in a significantly unbalanced manner, it really can make the whole problem worse. You might be thinking right now, well, why the hell are these exercises continually recommended? And the simple fact of the matter is a lot of practitioners just aren't aware of this, whether they're osteopaths or chiropractors or physios, and certainly your GPs, they just don't have the training or the experience. A lot of those guys never look at the imaging. They get a written report, but they don't see the imaging. They don't have that database of understanding for a number of different reasons, not least of which a lot of practitioners will work in generalist practices. So they might see shoulders and knees and elbows and necks and backs and everything else, and they're not specialists in this. So they don't have that level of understanding, which is why they chase some of those exercises that provide moment-to-moment relief at the expense of the long-term problem. They just don't have that depth of understanding with regards to what's actually going on in the spine and how it really works. The spine fundamentally is built to move in all directions. It's supposed to be stronger in certain positions than others, just based on the forces and the position that it's in. No different to if you were to do a squat, for example, you would stand nice and stable with your feet a little bit wider apart. You wouldn't lean off to the side on one toe all the way over here to try and do a squat. You're just not in as a balanced position. So the spine is just the same. And when it's injured, we have to consider that certain structures might well be compromised. And if we put our spine into specific positions, we might compromise them even further. With all manner of other injuries, there is an acknowledgement that we need to give a certain area of the body a bit of time to recover. And quite often, in some of the more severe injuries, you're going to find that you might be in a cast or in a boot or something like that for a short period of time. The simple reality is we don't have a second lumbar spine to lean on. We don't have the ability to isolate it because it's not practical and not advisable for any length of time. So we have to do our best. And that starts with learning to stabilize the lumbar spine. The simple fact of the matter is those forward bending exercises need to be gotten rid of. You need to spend time focusing on exercises such as the simple ability to engage your core and control your spine to start with. Then exercises like the modified dead bug, which will help teach you how to stabilize that spine as your legs are moving in different directions. Another great example is the marching bridge, another very good beginner exercise that we can all do to start to build in a bit of stability to our lumbar spine. And what you'll find is as you start to build in that stability, your back gets aggravated less and less during the day. So inflammation builds up less frequently in these spaces. So you feel the need to less frequently want to do those forward bending activities because you're actually starting to do something that has a cumulative benefit. the strengthening and control-based exercises. And over time, you can add in upright movements such as the squat, such as the hip hinge, such as the step up and reverse lunges. We've got videos on all of these linked down in the description to help you be able to do these more effectively and start to learn to rehabilitate control back into your spine whilst it's in this vulnerable position. And there are some other tools that you can use to help you alongside this, such as the towel decompression, which is a great way to provide moment-to-moment relief without coming at the cost of making the underlying problem worse. Again, linked down in the description. Finally, in terms of moment-to-moment relief, a great strategy is the use of contrast bathing or hot and cold therapy to manage the excess inflammation in those early days down here in the lower back, whether it's sciatica or whether it's a lumbar spine or lower back pain specifically. Targeting that area of the lower back with the contrast therapy can help, again, you manage the inflammation without the need to do silly movements that are, unhelpful for your lower back recovery, such as the knee hug and the child's pose. If you commit to learning to do these exercises correctly, you won't have the need to do more forward bending. You're going to have plenty of movement going through your spine in daily life because chances are you're not going to be bedbound, because that's not good either. You're going to still be living life regardless of the back pain that you've got. You're going to struggle to get through it. And if you can do it as best you can with a nice neutral spine, start to develop some control and strength and progress on further as you start to feel a little bit better and a little bit more able to do so, to push some of those load-bearing exercises to help guide that recovery and healing process. You'll find you finally get relief and recovery. And the simple truth is we know this because, perhaps like yourself, so many of our members came to us and patients visited us in clinic doing these sorts of silly exercises, not going anywhere, and really getting stuck in a rut. And when they stop doing those and start doing these things, they actually build skills and a foundation that can be built upon with additional exercises to really safeguard that lower back. So it goes through the appropriate healing process, and then they can really start to not only be out of pain, but do all the real things in life that they want to do again. So I hope you found this video enlightening. You understand a little bit more about why those forward bending exercises are not good and perhaps why they've been recommended so frequently by so many. But there is a growing group of people and practitioners around the world that are teaching the right sort of things. Spine stability first, avoiding some of those forward bending exercises. And as you start to engage in them, the changes can be quite dramatic in a relatively short period of time, even for those that have had years or even decades of lower back trouble. If you do have any further questions about this, post down in the comments below. We read and reply to all of those, and hopefully we can shed a little bit more light on anything that wasn't quite clear in this particular video. And as always, if you need any direct help, we've got the masterclass link down there in the description at the top, and also the full membership to the Back in Shape program, where we can help you specifically get your back in shape for the long term. Thanks so much for watching this far. If you know someone else that could benefit from this video, then do consider sharing it with them, and we'll see you in the next video.